11 on the coronavirus here in our state. New COVID numbers were released earlier this afternoon, and the positivity rate is less than 1%. You see it right there, 0.81%. Hospitalizations, however, are up 4, and 2 more people have passed away. Channel 3 is your vaccine authority, and as the demand for vaccines levels off, many are wondering now about booster shots. Will we need one? Won't we? Who knows, right? Scientists still trying to figure it all out, but Channel 3 Eyewitness News reporter Sharon Johnson did speak with local experts about a possible timeline. She is joining us live right now from the Connecticut Department of Public Health Lab with more details. Sharon.
Well, Mark, there are a lot of questions surrounding booster shots. That timeline for booster shots is unclear right now, but the experts I spoke with say that researchers are conducting trials to try to figure out how long the vaccine immunity will last.
He's much happier now.
Sharon Etchman's husband lives at the Chesterfield's Apple Rehab facility. He was a part of one of the first groups in the state to get vaccinated.
Once I get into his room, because we've both been vaccinated, I can hug him, I can kiss him, I can touch him. We could not do that before.
But scientists are working to figure out how long the vaccine immunity lasts as the calendar gets closer to half a year since the most vulnerable, like Etchman's husband, were vaccinated. Doctors and scientists across the country have said people will likely need a booster shot, but haven't concluded when.
We know coronaviruses in general seem to last like maybe 2 to 5 years, so it is possible that maybe in that time period we might need a booster, but the data is still being collated.
Dr. Lisa Kuchara with Quinnipiac University says Pfizer and Moderna are doing trials right now to determine the need for boosters. She says a lot of it depends on the evolution of variants.
They have 3 arms, one group of people who have those 2 doses of the vaccine, one group of people that are getting a booster, and one group that is getting a booster that would be especially geared towards some of the variants.
Doctors are also keeping an eye on breakthrough cases, people who are fully vaccinated and still get COVID. Those cases have been low so far.
Most likely folks are going to need a booster, especially those that have any immune response issues. But really the NIH will be the ones that tell us whether or not a booster will be needed.
Dr. Carl Mingus with University of New Haven says right now the primary focus is still vaccinating as many people as possible. Etchman says she's also focusing on the present.
We just lost a whole year, which we'll never get that back. So I just want to make the most of what we have now.
And experts are keeping an eye on the Delta variant. That's a new variant of COVID-19 to see if vaccines are as effective against it. So far, the vaccines have been effective against most COVID-19 variants. Live in Rocky Hill tonight, Sharon Johnson, Channel 3 Eyewitness News.